Good morning, ladies and gentlemen. I'm Dr. Yap Boom Tu. I'm the regional representative for Africa of Epicentre, which is the research branch of MSF, Médecins Sans Frontières or Doctors Without Borders. I'm also associate professor in the Faculty of Medicine in Barawa University of Science and Technology and the University of Douala in Cameroon. I'm sure most of you would like to know more about the Ebola and the story of its vaccine. So I'm going to give you an insight in the Ebola vaccine trial. In 2014, the world faced an unprecedented outbreak of Ebola. Ebola virus disease is transmitted through the body fluid, has a very high mortality. And it also caused panic, as you've seen when cases of Ebola raised all around the world. It caused stigma, unfortunately also for those who survive. Though we are seeing the end of this outbreak, more than 20,000 people were affected by the disease, and half of them died. At the peak of the outbreak, the government of Guinea requested the World Health Organization, WHO, to help them implement an Ebola vaccine trial in Guinea as it was already planned for Liberia and Sierra Leone. WHO put together a group of institutions including MSF, Epicentre, the Norwegian Public Health, with the objective of assessing the efficacy, safety, and immunogenicity of a candidate vaccine. Among the three candidate vaccines available at that time, the one called RVSV-Zebov, quite interesting name, manufactured by Merck, was chosen because it was the most advanced to be used as a single dose, which means there will be no need to go and follow people after they receive the first dose. But also it was available enough quantity for the trial, and in case it would be proven effective, it could be made available. It's important to note that this vaccine doesn't contain attenuated Ebola virus, but just a tiny part, a gene that allows the body to generate the production of antibodies and hopefully the protection, but it's harmless. The question was how to test the vaccine, which design to use. It was clear that the result was urgently needed considering all the panic that was going out worldwide. So we decided to include in that trial the most affected population with two designs. The first one, the ring trial, to address the issue of efficacy and safety. And the second one, the first-line workers, also to address the safety but the immunogenicity as well. What is the ring trial? Quite simple, an old concept. When you find one case of Ebola, then you will make a list of all the people who have been in contact with that case, and you constitute a ring. All those people was divided in two groups. The first one will receive the vaccine as soon as we have found them. That will be the day or the day following the consent. The second group will receive the vaccine 3 weeks later after the first case has been found and after they have been identified. Of course, during the 3 weeks, they are followed. Then we could compare the two groups, looking at the number of cases arising in each group, but also the number of severe adverse events related to the vaccine. To start with the safety, we didn't find any related severe adverse event related to that vaccine. In terms of efficacy, in the group where the people received the vaccine immediately after they were found as contact, no participant declared the disease after the agreed window period of 10 days. While in the second group, where they received the vaccine 3 weeks later, 16 people declared the disease still after the window period of 10 days. That was showing that the vaccine is highly effective against Ebola disease. Now, to answer the second question of how the vaccine actually protects and for how long, we include the first-line workers. Those are the people who give a big tribute during the Ebola outbreaks. Those are clinicians, nurses, guard working in hospital, but also the people involved in burial, working for the Red Cross and others. Those who, because of the activity, were exposed to the Ebola virus disease. We include more than 2,000 of those people. They receive the vaccine. But before receiving the vaccine, we were collecting blood sample so that we can know the baseline, what are the level of protection against Ebola virus before the vaccine. Then for 3 to 6 months, we were collecting 5 blood samples so that we can compare how the protection will grow because of the vaccine. The investigations are ongoing, and we should be able to get the result that will give us the safety, but also the immunogenicity of the Ebola vaccine. All our staff in the trial, with very few exceptions, were motivated, devoted Guinean doctors, nurses, lab personnel, logisticians, support staff, supported by more senior staff for Epicenter. Beyond the science, this vaccine trial was a huge challenge. You imagine to set up the highest level of research following good clinical practice in a country where it has never been done. It was a challenge. There were also the logistic challenge. The vaccine has to be kept under -80 degrees, while the temperature in Conakry in the countryside was between 35 and 30 degrees during that time. We have to improvise and to find the best, the most efficient tool to keep our vaccine and our sample safe. We were also running the trial in the middle of an unprecedented outbreak of the scariest disease ever. At the time where the population were thinking that Ebola was brought by the NGOs, by the Western people, by the white people to kill African people, to do Ebola business, to get money with the lobby of pharmaceutical industry. It was a challenge. On top of that, it was the year of presidential election. It was seen as a tool, as a maneuver from the president to either delay or to win the election. And lastly, the belief of the population that Ebola was not a disease, but a witchcraft. Well, we did it because it was the thing to do. We actually had no choice but to test a tool to stop Ebola, and more importantly, to build a human research capacity in Africa to ensure that next time when it will happen for another disease, we will be ready. Thank you.